people to come in to the island. We actually have
Hey, look at that. What do you know?
we have the president of the Guam Visitors Bureau.
Yeah, because he heard that we had Thanksgiving Balutan to go this morning in the Zoom room. Let's bring on
Like,
former Governor Carl Gutierrez. He's currently, of course, the Guam Visitors Bureau president and CEO. Is he ready?
He's coming.
Oh, there he is. All right, yeah.
Good morning.
Good morning.
Morning,
Good morning, Governor.
a little bit early, but I'm on.
Hey, here we are. Yeah, JQ asked for you.
Oh, you did? Hiya, Jake.
Hey, you're still the one.
Yeah, right. Thank you, boy.
Yeah.
Ingrained in your soul there, JQ.
That's it.
It's in your soul.
My father-in-law was saying, never forget where you came from.
That's it, boy. Yeah. Politics is temporary, but love and family are forever.
That's right.
I don't think politics is temporary on Guam, though. But let's get into it, gentlemen, if you could. Talking about travel, right? So JQ was just talking about enticing people to come to Guam, and different people want to go golf. They want to go to the beach. And so,
We
of
can
course,
do some online shopping.
online
yeah,
shopping.
something here.
Yeah. Go ahead.
And so, Uncle Carl, if you could talk about how GVB has been working with GIAA and I guess Gita as well about this strategy towards reopening Guam and how we're going to welcome back tourists, albeit it might be a while away, but, we got a plan now.
Well, if anybody can, help do this, is of course JQ and the airport, and we have been communicating, and we were moving forward with a testing protocol, but then we were told that that's already been put together by the surgeon cell, and that we should just wait until the numbers go down, and then we can try to implement that. So that kind of puts us on the side, and again, to wait and see what we can do, because it all depends on the numbers going down, because that's the governor's call. But JQ is prepared at the airport. He's got all of his sites delineated, and that we also been talking to the business community on make sure that they follow certain protocols from the airport all the way down. Every business that's involved in tourism are to be, admonished if they're not following the protocols. And I believe they will follow the protocol. Your businesses depend on it. And that I think that we should start considering something about, individual responsibility now. And I know that I probably will, not be taken gracefully, but I think we need to be able to say that, I'm 79 years old. I know how to take care of myself. I got a little granddaughter here, Emmy, that I just will not, allow myself to get sick. And so once we start giving responsibility to the people, those that are vulnerable, particularly, they know what to do, especially after all these deaths are coming up to a certain number, that it's a serious disease. And so that we must, let's try it and see whether that individual responsibility, the businesses are all set to do it. The airport is ready, and GVB is ready to continue to monitor the protocols are being followed, so that we can at least show our marketplaces like Japan, Korea, and Taiwan that we have put something together that will ensure their safety. So that's what we're trying to do, but we're under the numbers, and the numbers do not show us moving forward. So JQ and I are still working. Hopefully that when the surgeon cell says, let's implement this thing, he's ready, we're ready, and we're going to move forward.
Is it a little bit of a cha-cha when because we had talked to you, I want to say back in July, and you were ready to go and moving forward with reopening tourism. And then we had that surge. So it's like 2 steps forward, 2 steps back. Where are we now? Are we 2 steps back? Looking to go
I think
forward?
our morning, so this morning, the car score went down to 8. So
8
we're
this morning, yeah.
trending in the right direction.
But again, that could just go up in a matter
Right.
of another grouping
Right.
of so.
Yeah.
And
You
this
know, the
weekend
way I
also, the Thanksgiving holiday tomorrow, it's going to be a test to this.
Yeah, and I think the people of Guam are testing this idea of not needing a vaccine, because by the time we're done with this thing, we'll all be in herd immunity already by ourselves.
Yeah.
What are your thoughts on this whole the CDC designation? I think it's level 4, mainly putting out the message to the world: do not travel to Guam. There's a high risk of COVID-19 here.
Well, certainly that didn't help, and we take that with a grain of salt as well. But it does hit us very, very, very hard. Our core markets are reading that, and certainly they're going to take heed to that warning, and hopefully the governor and the group that are monitoring this protocol will bring the numbers down further. I thought it was 9, but now it's 8, as JQ said.
Yeah.
And hopefully it'll go down below 5 soon. And like I said, maybe by the time we're ready, that everybody's already finished having it.
Mm-hmm. And Gov, you did mention the surgeon cell, and I guess their plan. How much does it differentiate from the plan that was presented by Gerry Perez, who's actually on the line with us?
Hey, good morning, Gerry. Gerry Perez, GVB VP, also in the Zoom room. Good morning, Gerry. Thanks for joining us.
Good morning.
I don't believe that we've seen that protocol myself, so maybe Gerry has seen it. Gerry, and you can make the comparison between what we were trying to do and what the surgeon cell, if they have shown you their protocol that they're going to implement at the airport.
Yeah, they basically have a plan, but they need to develop the strategy, and that's what JQ and Ricky and I are really trying to put together, because what they presented is they call it strategy, but it's really not a strategy. I mean, it is a strategy. It's not a plan. They wanted to do testing prior to arrivals and some capabilities for testing on arrival at the airport, which JQ and those guys have set aside some space for that to take place if that should be the case. But we still need to develop the actual plan. What the surgeon cell really released is just a strategy. And so it's up to the airport, and we are trying to develop the specifics on how that strategy actually is going to be implemented. Is that correct, JQ?
That's correct. So
What's the strategy, guys? Gosh, tell us what strategy does the surgeon cell have?
Like I said earlier, Chris, there's several courses of action that they have presented to me. All they got to do is tell me which one is it, and we will take that strategy and finalize it. We got the subject matter experts that can take it to the next level. We just need to know which one. It's like going to the shoe store and saying, "Hey, which shoe do you want to wear?" Once you let me know, then we can match your pants and your shirt to it. But that's all we're waiting for.
Does it bother? Does it bother you?
I'm sorry. This is really less a medical issue and more a management issue on what to do. Okay, the medical issues can be resolved easily. It's just the what to do process, which is the plan that JQ and I are talking about, needs to be worked out, and that has not really been done. And that's what we're working now to try to pull together, so that when the governor is inclined to agree with it, at least we have something in writing that spells it all out.
Sounds like you guys are kind of waiting on the surgeon cell.
Well, you guys came up with the plan, from what I understand, and you had presented it to the governor.
The plan you're talking about, is that the UOG coalition with JHRA and everybody else? Is that the plan you're talking about?
Didn't you present a plan to the governor? Is that the plan?
Yeah, that was the plan that was presented jointly with UOG, who was taking the lead on that, but it really went nowhere. First of all, because the price tag was like $10 million or more, and there's a whole bureaucracy that's going to be built into that. And by the time, by the time you stand it up 2 or 3 months from now, you already have a vaccine. So they've since recalibrated that because the governor wanted public health to be more involved in that plan. And so that's where things are now. But I think they've kind of recalibrated that plan and are focusing more on the businesses and doing an audit in the businesses to make them COVID safe and helping them educate them to make them safe, while the testing part of the plan is pretty much defaulted still to public health because they have not relinquished any authority or any authorization for us to proceed with the rapid testing. They're doing it themselves, basically.
But did the plan that you worked on, did it include anything about the rapid testing at the airport?
Yeah, actually that was part of the package. But there's another plan that Governor Carl, I don't know whether you mentioned this earlier before I came on, that we're looking at, that is an end-to-end product. And we actually discussed this with the Surgeon Cell, who had some questions. We have since received those answers, Governor, and I was just gonna share that with you later today to see what we need to do moving forward now that we got the answers. And it's very, very promising because it's actually going to do certain things that the current testing strategy is not doing.
Yeah, I did receive those answers, and let me just say that when we presented this to the Surgeon Cell, Mike was there, Dr. Cruz was there, and Terry Uggan of Public Health was there, and Mike, Dr. Cruz got up and said, "Man, this is blowing me away." And the only thing is that I have a question on is how do we get reimbursement, et cetera, from wherever they get from the federal government. But he liked the idea so well. But I haven't heard back from Dr. Cruz, and hopefully these answers now, as we move it forward to him, that he can then reevaluate it, because he did like the presentation very much. And like he said, it blew him away that this is such a workable thing that we put together with the business community being involved as well. And so hopefully that can have a second look, because to me, that's really an easier workable plan that Jerry and I and the GBB crew and Jeff Marshall, who brought these people in, has presented. I think, JQ, you watched that too, right?
Yes, sir.
Yeah, and it's workable, and it's all encompassing, like Jerry said, end to end. And it's hopefully even less expensive than the way the procedure works. It makes it easy on travelers as well as the fear by the local community being allayed.
Yeah, one of the reasons why Sergeant Estabrook and the Surgeon Cell crews raised these questions is the reimbursability of the plan. And so the good news is that the test kits are actually FDA approved. They have basically two antigen kits. One of them is the nasal swab, not as intrusive as the regular one, but halfway up. The nasal swab one has FDA and emergency use approval by FDA. The one that they're awaiting approval for is the home kit, the kit that you can do it yourself at home to take. So that's very promising. The fact that the fact that it can be reimbursable, because that's the one that we would needed to work on. If we get the private businesses to aggregate and buy into this thing and they get it done, and the ability to be reimbursed is important. The second thing actually is that the difference between what they're doing now in Guam And what we're planning to offer is that the quality of the testing along with the integrated technology. And so what is happening then is the safety protocols are interlaced with the testing and is embedded in an app, so that this is not being done right now at any part of Guam's current locations. And the nice thing about this is, even if these other antigen cases by other locations are done, the what do you call it? Having a senior moment here. The app that they have can actually integrate with that so that it can track people. So you're talking about contact tracing with 100% penetration instead of the 30% that we've got now with Guam COVID Alert.
Oh, speaking of Guam COVID Alert, you said only 30% have enrolled in it or have downloaded this?
Right now, it's getting closer to 35%, I think, which, I mean, we think it's really not good enough, but you should know that we were just contacted by MIT because of all the jurisdictions that they rolled out this app, we actually have the highest percentage of download, as low as it is.
Okay, and just for clarification, this end-to-end plan that you guys have been talking about, is it different from this surgeon cell strategy protocol or included in the end-to-end plan?
No, this end-to-end service actually is the antigen tests that they use together with the series of questions front end. There's like a 3-step process in the front. And then before you take the antigen test, and when you take the antigen test, you automatically get downloaded with the contact tracing app. So no matter where you go, or if you come back or whatever, this thing is embedded in your app already. And so
let me add this, Sabrina, that the app that Jerry is talking about is that, so we got 30% of the COVID tracing app, and that's not enough because we wanted to get like 75,000 people on there. We didn't quite get that. But with this thing, if you wanted to go in, for example, to Micronesia Mall, you go through this protocol, and that in order for you to enter this private business, part of the process is that you download it. And so it makes it easier to get people on there. If you want to go into the hotel or the restaurants and you go through their protocol, you need to download that for the follow through. And so that's where this thing really makes it work better.
So should I delete the COVID Alert app or what? I feel like I'm the last guy who's got it.
No, actually, that's still useful because that actually is being used together with was it SARI, JQ?
The Sarah
the other one. And so those have the 2 different purposes, but that actually works, even if it's only like 30%. Now, if you want to use this other app that is associated with this Wellness for Humanity end-to-end product that we're talking about, that's a different issue. I mean, it's in addition to the COVID Alert app that you have now, because what happens is you might have somebody that might be testing positive that could ping you that's outside of the orbit of the Wellness for Humanity app that we're talking about.
Okay, that's enough with the apps. What about a timeline for reopening tourism? Hey, Jason's getting excited over there with all this app talk. Let's dumb it down a little bit. I mean, what is the timeline to reopen tourism? Are there tourists in the world who are traveling and would come to Guam, and when?
You're talking about Jason excited of app, as long as he's not apoplectic.
I don't even know what that means.
Well, Chris, the Japan Airlines is not going to start flying till January 31st. So we're going to look at the source market and how they look at Guam. So we're looking at that thing, and the airlines themselves. United is so eager to start moving. that they're nudging everybody in the government to come up with a plan that's workable so we can begin the implementation. Other things might befall our mainstay carrier here if we don't hurry up and do something for them to start, bringing those. I understand they're going to knock down 75% of their flights to Guam. I'm hearing that out there, and if we don't do something fast, it might take us a hell of a long time to recover. And so, we got to do something. Like I said, I think individual responsibility now to the businesses, to the people, the vulnerable ones, to take care of ourselves, because we tried, and it went up, and now it's going down. We hope it stays down, but I think that there's going to be lawsuits and all that kind of stuff, and so that individual responsibility, individual rights that we have, I think should be starting to be looked at. The businesses are not going to skip on some of the protocols, because it will just be deleterious to their business if they don't follow it. So let's start giving some responsibility back to the people.
Have you talked to the governor about this, Uncle Carl? Because it kind of sounds like you're.
Somebody's going to be talking to me pretty soon. I know.
They're going to call you in after this interview, right? They'll be like, "What's all this talk about individual responsibility? We told them strive for 5, Carl." I feel like every time you come on the link, they always call you to the principal's office after.
Okay, what?
I feel like they always call you down to the principal's office every time you come on the link. It's just too easy to get talkative here.
I got a lot of Atambaba.
And it's extra Atambaba, especially if it's over Zoom, right?
Right, yeah. No, but so the CAR score, right? That's the metric that they're using to determine whether or not we're going to be granted more freedoms by Christmas. If it's 8 now, are you guys confident that it could get down to 5? And then when it does get down to 5, how do you kind of market this CAR score out there to the source markets and the tourism areas when we're under this CDC guidance, right? So it's a little bit of a conflicting message. And then how do you market on a CAR score of 5 when it could turn around and go up by 30 points the next day or within the next couple of days? It seems very fragile.
Well, we got to work at removing ourselves from that alert from the CDC, and I think we get ourselves removed when we go down to a sustainable level below 5. So once that happens, then of course that we negate all that bad publicity we got last week. So that's what the governor's working on. Hopefully it goes down, and I believe she's being successful right now in it going down, and that's what we have to work on, right now. But the plan needs to be looked at and finalized, and hopefully bring to the governor over the next week or week and a half to see which plan she would accept and which plan the surgeon cell will accept, because the business community needs to be brought in here. Some of them might be willing to pay for some of this cost, but some of the smaller businesses may not be able to afford it. So we're trying to get some CARES money from the governor to be able to say, let's do a plan from December to March, 4 months, and see whether we can, because by March or April, the vaccine will be very readily available on Guam. So let's try to get some $1 million or $2 million that's necessary, and make a contract with these people that have this program, as they're working right now with Aspen, Colorado. And in order for you to get into Aspen, Colorado, you got to go through this whole procedure. But so that's something that we need to be able to really push for. Just 4 months while they roll out the vaccine. And it may cost us, like I said, $1 million or $2 million, and pull everybody in. So we don't have the small businesses like Lone Star that can't afford to get to pay for that service and that test kits and the whole program. The airport could probably, but they're just in the periphery on this thing. But it's the business community that would employ this program.
Yeah, actually, Chris, it's not really either or. The whole the whole idea is to recognize that the government resources are overwhelmed right now, and that whatever we can do in the private sector through private initiative to complement and to add value to what they're doing now is just going to ease their being overwhelmed with the situation. So our approach is not to replace or to do what they're doing already, but to augment what they're already doing. And so in fairness to the governor, what has happened when we talked about this Wellness for Humanity product is that she encouraged us to meet first with public health and the surgeon cell to answer some questions that they might have. That differed from the original presentation made by the University of Guam, where none of these players had been consulted before, or at least had a part in it. So now that we've got these questions by the surgeon cell and public health answered, now we owe them, I think, Governor, we owe them like another meeting to explain. And then before we even talk to the governor, at least, so she knows ahead of time that all these questions that were raised have been resolved or have been answered.
Can I ask?
We just got that in yesterday, so we're going to start moving forward with that since the questions were answered yesterday. So we have to present that to the surgeon cell and public health.
Whatever happened to this idea I heard, I think it was last month, about a fight bubble on Guam with the fighters from the Philippines? Is that kind of dissolved, seeing as how the surge just kept getting worse at the time you guys were discussing that? And did you ever nail down anything concrete on it?
I'm not sure
from our point, we don't know about a flight bubble from Philippines, but the flight bubble that
fight bubble,
like PFC
fight bubble, yeah. Mixed martial artists coming to Guam. They're
was it not UFC, FC something.
Something FC.
Yeah, JQ, that's the one that we talked about a couple of weeks ago. And we've actually talked to our source markets and see what the feasibility is to do that. And there appears that it might be possible in some of the markets. So we just need to talk those issues. But what has happened since that time is this explosion in positive cases, and that kind of like derailed us from pursuing that conversation. But now that the CAR scores are coming down, JQ, I think maybe it's time for us to kind of regroup and talk through that 18-hour turnaround time or 24-hour turnaround time that we talked about.
That's the one I explained, Chris and Sabrina earlier, concerning flight bubble coming in for folks that come in, like, for example, Taiwan, and they want to do golf, and then they go to a restaurant that's set up for them, and then shopping that's set up for them. That's a kind of idea that we were talking about.
The reason why we're targeting Taiwan is that this Director General here from the TECO office is really also pushing his government to be able to try to work something out with Guam. He really has been an advocate for Guam and getting tourism open up. As a matter of fact, we've got already 2 airlines approved from Taiwan, EVA Air and China Air, and the third one, Starlux, has already applied for that thing. So it's a promising market for Taiwan. And the Director General here, Paul Chen, is really, really helpful in trying to get us. And now that the numbers are going down, we can again revisit this flight bubble that JQ has put together.
He was talking about something else.
Yeah, no, and that's interesting too.
Right.
His muffled, that's why I can't really understand.
It's my individual responsibility.
But you're all alone. Why are you using a mask if you're all alone?
Oh, they're together, actually.
Yeah, we're all in the studio,
okay.
man. Yeah.
Sorry.
Yeah, no problem.
Well, thank you guys. Was there anything else you guys were working on other than? I think it's interesting that it seems like you guys haven't been working with the surgeon cell, like together to come up with what we're gonna do. And now that I don't know how many plans have you guys come up with, and now you have to have input
Well,
from the surgeon
well,
cell and public health, and I mean,
Sabrina,
it's everybody working together, or what?
yeah, Sabrina, the fundamental plan that actually we proposed, Governor, what, about 3 months ago, right, or so, was to promote the use of rapid testing. So cheaper rapid testing repeated, is our basic strategy on catching it at the pass, and then screening, and that would focus scarce resources on positive cases. And so that was the central thrust of our plan, however it's executed. But that's the fundamental difference. And so actually what they're doing now is exactly that. They're doing some rapid testing in clusters now because they see the value of rapid testing in problem areas. And so that, I think that has been the basic distinction, correct me if I'm wrong, JQ or Carl, that we had been discussing before.
And we're back to it.
It almost seems like the surgeon cell's like, oh God, here comes those pesky GVB people again with their, God, we're kind of busy with this pandemic, guys. Is that the vibe you're getting? Because that's what it sounds like.
No, we've tried to be supportive, honestly, whatever it is, I mean, we can all have honest differences of opinion, but our main
that's the vibe.
Is let's get this thing behind us so that we can do our job.
Jason.
That was a polite way.
Yeah, it's a good way. Always classy with it, Jerry.
Diplomatic.
Jason, did you have something?
Oh, okay. I had actually, when Mr. Perez was like trying to say like what the percentage and the penetration of the app was at this point, I just reached out to Public Health and they said at current we're at 23,300 downloads. That gives us about 32%. Remember, they were shooting for 75%.
Right.
For
but we haven't really heard anything about the app. I mean, they were drumming the app and download the app, and we did a big thing that led to a lot of downloads, right? But haven't really heard anything about the app lately. I mean, does it even work?
Yeah, as far as I know, they're using it. I don't know how consistently. That's a different issue.
Right.
But I know it's being used. And that also is paired or in addition to the SARI alert, which is positive cases that they're tracking on a lot of particularly arrival subjects. But I didn't realize this, but just yesterday we got a couple of questions from MIT because in all the different jurisdictions that they've rolled this out, as low as we are on 32% or 33%, that's still the most that they ever had in any other jurisdiction that they tried. And I think Iceland was one of the better ones that they had. It was only 29%.
Jerry, for clarification, that Wellness for Humanity, is it an app? Because I just Googled Wellness for Humanity. And
No, Wellness for Humanity. No, Wellness for Humanity is the name of the enterprise. Okay, and their end-to-end service includes the app as part of their contact tracing. So when you come into their orbit, you automatically get included in this app, and so that's why it's called end-to-end service, because they do the screening and then there's constant follow-up and monitoring for contact tracing.
Their app is called Contact.
Yeah, they're actually, like the government mentioned, they're trying to get in Aspen, but they're also their clients include like the Ritz-Carlton, the Marriott Hotel. They got a couple locations in Hawaii and Kailua. They're into Texas, Georgia, and Florida, and they're finalizing a deal now with Delta Airlines, and they do a lot of the product testing in a number of Fox TV stations across the U.S. So, they're the real deal. I mean, it's just I'm sure there are probably other competing enterprises, but this is the one that we've kind of like got to know better.
Right. So basically, layman's terms, if I'm a tourist from, let's say, Taiwan, I come to Guam, I'm in this bubble where I go to this golf course. It has been like we have a deal, this golf course for the people who are coming in as tourists. Then I stay at this hotel. I go eat at these certain restaurants that are all part of this bubble, all being monitored, tracked, and what have you with this end-to-end thing.
Yeah, conceivably, it could grow to that level, Chris.
So you take the,
Chris,
And that's why
this includes
that's why
like
it's
the
important
testing.
that's why it's really important for like some of the businesses like shopping centers or places like that where you want to come in, you got to go through this process. If you don't want to go through this process, sorry, you can't come in. And they do the same thing for the employees. You test your employees every 2-3 days. It depends on what your protocol requirements are. Some of the smaller businesses may not require testing every week, maybe once a month. It's flexible.
Chris, I was just informed that the question you were asking me, I couldn't understand, but I was told that it was the UFC you were talking about.
Something with the fighters, yeah, and there was
Yeah,
going to be
you
a.
had mentioned it the last time
Yeah.
you were on.
You were
Yeah,
talking
that,
about.
well,
go
of
ahead.
course, we sent that time. We already sent the letter to public health, and they haven't responded.
Okay. Okay, we're
Yeah,
good.
Yeah, the thing with the UFC fighters, they get tested constantly. They get tested before they arrive in Guam. They get tested before the match, and they get tested after the match before they leave. So it's a constant, follow-up.
Yeah. It kind of sounds like you guys are in the Jim Moylan category where you write letters and no one answers, and you call in the surgeon's cell. They're like, "Oh no, that's Uncle Carl. Don't answer. Don't answer. I told him March already." But I guess I appreciate that you're continuing to move forward. That's one thing about Uncle Carl. He's always moving forward. So it's good to see you guys are keeping busy over there. Anything in closing? Happy Thanksgiving, maybe?
Yes, let me say that when we talk about somebody presenting this fight and all that, but it's not limited to just one person. And we're talking about the concept, and that concept could be anyone that can provoke that idea, because it is it is workable.
Yeah.
It's been working somewhere else, and I think we can do that.
I mean, you could even do it with like the Filipino basketball teams, I guess, right? Would be another concept.
Yeah.
Okay. JQ, thanks for hanging out with us.
All right.
Thank
Happy
you.
Thanksgiving. Be safe and stay home.
Right on. There's
Thanksgiving.
Balutan to go in the Zoom room if you guys want to take some of that on your way out. Okay.
All right.
Thank you, Uncle Carl. Thank you, Jerry.
Thank you.
Bye. Happy Thanksgiving.
Happy Thanksgiving. There you
Happy
go.
Thanksgiving to you guys.
Good talk. See you. Yeah, Jay. Oh,
That's a lot of material.
Yeah.
Ooh.
A lot of good stuff too. A lot of